Then we're going to get you to start to think about what your hips are doing. So one thing that you can try is getting your patient to squeeze their glutes while they go into a single leg squat. What that can actually do though is, particularly if they're engaging their glute max a lot, is actually they don't then know how to bend their hip while they use those glutes eccentrically. So what I'll get you to do instead is shift your weight onto your left foot, right foot out in front. Now just really try and maintain your pelvis at this level as you go down. So nice and slow. Good, and back up again. Try and engage these muscles through here. Okay. All right. Okay. And now another cue to think about is tracking that kneecap over your second toe. So as you come down, you're thinking about your trunk and your hips or your pelvis. And now think about keeping that kneecap in line with your second toe. Okay. Now, what we can see here is that it's quite challenging for Josh to be able to do this. There's a couple of things we can do here. We might want to just park this exercise for a bit, for a couple of weeks, and get him to do some really targeted strengthening to his hip abductors and external rotators, so that when he comes back to do this particular movement, he does actually have more capacity in his muscle to be able to support that movement pattern. The other thing that we could do is start to build that muscle control into an exercise that is very similar to a single leg squat. And this is one of Jenny McConnell's exercises where we do some isometric hip abductor and external rotation work. So Josh, what I'm going to get you to do, I'm going to demonstrate for you first. We're going to get you standing right up close to the wall here, almost touching the wall with your arm. We're going to be standing on your outside leg. I'm going to get you to turn that leg in about 10 degrees. And this leg's going to be bent up with your knee pushing into the wall. Now, the movement that we're going to do in that position is an external rotation, or pushing that side of your knee into the wall. What Josh should be using here, or feeling it, is in his standing leg, so particularly in his hip external rotators and abductors. So you want to give that a go, Josh? So right up close to the wall, you need to turn that foot in a little bit by 10 degrees. Okay, now stand up nice and tall first. Okay, we want to be reasonably straight with a very small bend in this knee so it's not locked back into extension. And the movement is just to push that part of your knee into the wall. And you should be feeling that in this hip. So just try straightening that knee a little bit more. Straighten, that's it. So it's just off full extension. Ideally, we want to be making sure that Josh has got his pelvis nice and level, so drop this hip down a little bit. Cool. Bring your knee forward a fraction. Okay, and then when you push that into the wall, so keep that foot nice and level, pushing the outside of that knee into the wall. Can you feel that in these muscles? Excellent. Okay, so it is a really targeted exercise to those rotators, because the moment that you're putting on this is a rotation moment. And we want to hold that for anywhere around 20 to 30 seconds as a really nice isometric exercise.